Hello again, everyone. Thanks again for tuning in to My Doctor Doesn't Listen to Me. My name is Andy McDermott, and this is episode 2, which I have called We Did This to Ourselves. Most of what we're talking about today is based off of ground rule number 1, which is everyone's to blame, no one's to blame. A lot of issues we're dealing with in the healthcare world, and definitely in the primary care realms, is changes that have happened over time that have really been aimed at improving safety, efficiency, and trying to create a more patient-centered experience. I think all of this was done in good efforts and good intentions, but in the end, I think we've done the opposite. We all want the same thing. Patients want more time to talk to their doctors about what is causing them issues, concerns, and they want to get better. And to be honest with you, healthcare providers, we want more time with patients. And we're struggling with this very, very simple concept of time. I like being able to spend time with my patients, get to understand them, get to know them, and see what makes them tick. It's incredibly important for me to understand the patient and their story. And if I can get a grasp of that, I think typically the experience that we have winds up being incredible. This idea of spending time and understanding our patients is fundamental in primary care, and I've become personally increasingly more frustrated with just how little time I get to spend with my patients. I thought it would be interesting to look into just how much time do doctors spend with their patients. And I looked even at my own practice to see how much time do I personally think I'm spending with my patients. So here's my math based off of how much time I think I spend with my patients in my practice. In my practice, I'm given 20 minutes for an appointment slot with my patients. This varies from practice to practice around the country. It can be as little as 10 minutes, maybe even 5 minutes in some instances. Probably on average, somewhere around 15 minutes, most practices will allot for a doctor to talk to their patient. The amount of time that I'm given and that I take just to listen to the patient's concerns when they come in is somewhere between about 3 to 5 minutes. The time to do a physical examination, probably somewhere between 3 to 5 minutes. The time to review prior studies, laboratory work, radiology work, and also review previous encounters that other providers or myself have had with the patient. We're talking another 3 to 5 minutes. Actually discussing, talking to the patient about the treatment plan and moving forward, 3 to 5 minutes. And then what becomes a little bit of a burden is the time that we're required as healthcare providers to actually put information into the electronic medical record. And that's probably about 5 minutes for each patient. All that math work, put it together, and the average appointment length, based off of what I think is a reasonable patient encounter, is somewhere between 17 to 25 minutes. So based off of this estimate of a 17 to 25 minute appointment, there's a lot of assumptions. Assumption number 1 is that the patient's only coming in with one complaint. I find in my practice that patients will typically come in with more than one complaint, sometimes up to 2, 3, maybe even 4. And if you add those up, the time spent or really necessary to listen to the patient's concerns is going to go up. The time to actually discuss the treatment plan, that's going to go up. Potentially the time to do the exam, that's going to go up. To be fair, there are some appointments where patients are coming in for medication renewals, just to review lab work, in which instance they don't really have a concern. They're just reviewing the lab work, and that appointment time may be well less than 20 minutes. So to be fair, there's going to be fluctuation in our appointment times. Another assumption is, much like some appointments may only be 5 minutes for a renewal of a prescription or to review some laboratory work, our appointments are 20 minutes regardless. So that also means if a patient wants to come in for an annual physical exam, review lab work, do a full head to toe examination, order lab work, renew medications, this very easily can exceed 30 to 40 minutes. So you really have to balance out the small appointment times with the large appointment times, despite the fact that our appointments are slated for 20 minutes at a time. To take all things into consideration, I typically like to spend somewhere between 6 to 10 minutes talking with my patients about their healthcare in general. Some of that's going to delve into maybe non-medically related stuff, asking how their family's doing, what they like to do with fun, their plans for the weekend, just because I think getting to know the person is so important in establishing a meaningful patient-physician relationship. I will admit I tend to run over in my clinic by about 5 to 10 minutes, and it's probably because of that very reason. I do think it's worth it though. So that's my appointment in my clinic, and I looked into the research to see what about other docs and other practices, and what are they doing in their appointment types. And on average, doctors spend somewhere between 13 to 16 minutes for an appointment with their patients. That is very simply the appointment time that is allocated for the patient, 13 to 16 minutes. Take it a step further. The actual time that's spent with the patient interacting is about 50% of that 13 to 16 minutes. So now what we're dealing with is an appointment time or meaningful interaction that's between 7 to 9 minutes with the patient. So what I ask is, as the doctor or as the patient, are you happy with spending 6 to 9 minutes actually interacting about healthcare? I think if you told that to a doctor or you told that to a patient, they would laugh in your face and they would think it's absolutely ridiculous that that's the amount of time that they're actually getting to talk to their provider. And I think physicians would do the same. I think they're frustrated. I think they're fed up with just how limited that time is. So what I charge you, and you meaning physicians, healthcare providers, and patients, is why are we allowing ourselves to operate in a world where we're allocated 15 minutes, 20 minutes for an appointment, but we're only getting 6 to 9 minutes of meaningful interactions with patients? I'm not saying I have the answer for why this is the case. I have some suggestions, but I think we have to take a stance and say that this is just not good enough. So I urge you to write in the comment section below some of the things that you think are getting in the way of us having this very necessary interaction with healthcare providers and patients. I don't have all the answers, but I think some of the issues are going to be around time required to use the electronic medical record. I think part of this is going to be the business aspect of medicine, where, quite frankly, people want to see more appointments seen in as little time as possible. What I'll leave you with is, even if we are being measured from a financial standpoint on how many appointments I see in a day or in a week, it's kind of irrelevant, because if the quality of those appointments is very, very limited, we're really not doing anything good in the name of healthcare and improving whole body patient health. We're not establishing better relationships between providers and patients. So I think in the long term, we're counterintuitively messing with healthcare and patient outcomes. If we focus on the quality of the appointment, we really strive to improve and to make the relationship between the patient and the physician productive as possible, I think the healthcare world as a whole and outcomes of our patients is going to start to improve. Feel free to leave comments below. I'm looking forward to seeing what you have to say. Want to say thank you again for tuning in. Please hit that subscribe button. Again, this is episode 2 of My Doctor Doesn't Listen to Me, and look forward to a couple more episodes coming up here shortly. Thanks again, and my name's Andy McDermott. Y'all take care now.